2023 Health Equity Committee special meeting to order. We're going to do a roll call. Melinda, will you please go around and call individuals' names?
Okay, she's on mute.
Hold on a second. I'll have to pull that all up. Hold on a second. That's not something that I would do. Thank you.
Okay, I'll have Sheila do it.
Right, I'll do it off the paper. City Manager John Salomon. Patrick McCormick.
Here.
Police Chief Patrick Daly. Okay, sometimes he just is logged in. He's logged in. Bridget Marks here. Kate Mildy. Sheila Hayes, I'm here. Jennifer Granger. Mickey Walia.
Yep.
Thank you. Dr. Mohammed Qureshi. Dr. Alexander.
Dr. McLean is here instead.
Oh, McLean, okay. Joe Zulu there, Melissa Myers. Okay, Laura Dietrich and Kathleen Special.
Here.
Thank you.
Perfect. All right, folks. So that completes our call to order and attendance. I'll now entertain a motion to accept the meeting minutes from September. As you're aware, we did not have a quorum for our November meeting, so it's the September meeting minutes. So
I'll take a motion. I'll make the motion.
Second.
Sheila is the motion and Dr. Walia seconds. Roll call, all in favor?
You have to do it, yeah.
Oh, discussions? Any
No,
discussions?
you have to
I'll
do, you
call.
have to call people. You have to do.
All right, Kathy Special,
Aye.
Patrick McCormick,
Aye.
Al McLean,
I think I have to abstain because I don't know if I was present for that one.
Dr. Walia,
Aye.
Patrick Daly, Patrick McCormick.
Yep. Aye. Yep.
Right.
Yes.
Bridget Marks, yes.
And Joe Zuzell, yes. So motion carries. Thank you. Moving forward, we're going to talk about updates. So chair updates. I know that this says that we submitted the semi-annual report. We did do that. That was a while back. We are still working on sending out a recurring request for this meeting. So we do have all the email addresses together. We do have the Zoom link. Moving forward, we are going to be sending out a recurring meeting to everyone's calendar so that we have it. I apologize for the last minute agendas and reminders today. But moving forward, we will get that together. Just another reminder about if you are unable to attend and you can send someone in your place, that we're looking for that. We want to make sure that we can get a quorum whenever we can, since we meet so infrequently. Great attendance today, so we really appreciate that, especially during December. I think that's all I have for chair updates. We're going to move forward. Any questions or comments or concerns on anything that I spoke about in terms of chair updates?
Joe, we were going to have a subcommittee meeting. Did you have that in my absence? I was away for a couple of weeks.
No, I did not schedule our subcommittee meeting.
Okay.
But we can get to that when we talk about it. All right, so no further discussion on chair updates. We'll move to our next agenda item, which is our guest speaker. So it's my pleasure to introduce Representative Darrell Wilson, who's joined with us today. I know that since the start of this committee, we really had a lot of questions about the committee's scope, the committee's, breadth of work. We're really looking for a historical perspective. It took us a really long time to organize and sort of get together. So now we're sort of at a space where we're having consistent meetings, we're having some more attendance. We have our subcommittees, we have a mission, we have a vision. So now we'd really like to hear from you, since you're the author of the resolution, what you really had in mind when you're putting this committee together, what our expectation looks like, sort of present moment versus how when we extend further down what we're looking for. So maybe just a background on where the resolution came from and so on and so forth, and we can open it up to committee members.
Perfect. So, I started the resolution. So let me start by saying I was a city council member, of course, an alderman, when this resolution first was written. One of the things I also served as an alderman during the period of COVID-19. And one of the things that we noticed was this resolution really came out of our response to COVID-19 and realizing that we did some great things in COVID-19, but there were areas to improve. And I think for me, the real scope of why the resolution came about was, as a city, we did not have a true plan on how to attack many of our marginalized communities, from a language barrier perspective all the way down to where we are today of shoring up many of these areas of job shortage. And so for me, the big part was looking at some of our major areas within the pandemic and how we can put a plan together as a city to, if this ever happens again, one, we can address it. But I think for me, more so, it shed a light on where we are as a community when it comes to some of our disparities and inequities in healthcare and just in government, and how we can make it better for each and every resident. But more importantly, this was kind of a way for us to take a step back and utilize the pandemic response to truly put a system in place that works for all people. And so when I wrote the resolution, it is very long, and it was intentional. I believe understanding that the response to the pandemic and the post-pandemic involves all three tiers of the community, council, but also many of the government offices here in the city of Norwich. And so, and also our health care system. And so it's important that when we're coming up with a plan that works best for our community, all stakeholders need to be at the table. And so that is why you see a lot of, I think it's 13 total or 12 points. And so they were all intentional. We went back and forth. I know it took us a while to get this passed from the council perspective. I could have introduced it extremely early, but I was intentional to really do my homework as to what other communities have done around the state and around the region, but also to make sure I listened before coming up with this in-depth, comprehensive resolution. We passed it in July of 2021, I believe it was. And it was one of those where it was an evolving piece of, we had some changes that were made, adding different stakeholders and whatnot. And so it took some time before we even reached out to get kind of you guys organized. And then this is where we are. So I think I'll stop there and kind of let you guys ask questions as to what are the pieces that you're needing some help and guidance with.
So I'll open it up to the group. Is there anyone who has questions?
The only question I think we had asked in the beginning was, since this is something that the city is taking very seriously, are there any funds allocated towards this? And I think Sheila had answered that she wasn't sure at that time that there were any.
There were no funds allocated in the fiscal year.
Okay.
But based on some of our work, and this is what I was gonna explain, Joe has the paper. We broke out the 13. We broke the 13 points, we put them under subcommittee headings.
Yep.
And so we now have working subcommittees. And so to Dr. Wiley and to all of you, is that as a result of, as we start digging into some of the subcommittee work, we may find that we do need funding.
Correct.
Needs to go, that would be a report that needs to go back to the city council. I mean, obviously I now have another hat I'm wearing and now I'm a member of the council. So just to be mindful that the budget hearings will start in April. So if there are funds that we are going to need for the work to be put in the budget, we probably need to know by March, at least have some kind of general understanding of the funding and what it would be used for, so that request could go to the city manager and be put into next year's budget.
And I will say, one of the big things, I left the council at the beginning of 2020. But I started to phase out making serious decisions towards the end of that fiscal year of 2022. And one of the things I know we had talked about at that time, we had met with some different consultants and different angles to take this committee. And one of the things that we had talked about at that time, I know you guys weren't fully operational by the time we had those conversations, were at that time using ARPA dollars to help with some of the additional work. I will say, when I wrote the resolution, and I intentionally made it very broad as far as not giving you a definite scope as to how to go about handling it. And part of that is sometimes in government, we tell you exactly what we want to see and hear. Within this, we put together the team for you to tell us. And so there's a different interpretation, possibly, and that's okay. And so I think me telling you exactly how to do it doesn't serve the purpose of the community. I think you guys breaking it up into subcommittees, it's kind of where the vision was. It wasn't for me in the resolution to tell you this is exactly how you do it, because it sometimes hamstrings what you guys are able to do and operate as a committee. And so I left it at the high level for you guys to be able to choose. I think I said it several times while on the council floor is, I'm not expecting this work to be done in 2 years. I think it's one of those where it's a reauthorization from the council with the annual or semi-annual reports or whatever. But I'm expecting this is comprehensive work that's going to take some time. And so what it was is giving the 13 points. And, the committee may say, as a subcommittee, you've broken up into subcommittees. We really want to focus on these 3 points over the next 6 months. And we focus on these 3 points and refining them. And then we want to take the next set of points. I'm not expecting you to tackle all 13 points at once and come up with this comprehensive plan, because sometimes that just doesn't.
Yeah.
But I wanted to put everything on the table because as a committee of individuals with expertise in many of these areas that are being discussed in the points, you have a better understanding of what's more obtainable within a short period of time versus what's going to take some time to really come up with a plan. And so that was the point of giving you everything and then allowing you to arrange it. So there's no priority order in the 13. It's just a listing of all of the thoughts or the areas that we should look at and consider. And then you guys do your committee work. I mean, I let committees do their work and come back to us, and so this is not expected to take, I'm not expecting you to take 2 years and be done. It's going to take some time. And if you take it piece by piece, for me, it's about progress. So we're a better city now than we were 2 years ago. And 6 months from now, we're going to be a better city than we are today. And so I think that's the overall vision you should think about when you're looking at the 13. I'm not expecting you to tackle all 13 within 2 years. Take it piece by piece if you have to, and we're making the city move forward progressively in a way that makes us better than we were the next day.
I think that's really great clarification, especially for some folks who are on Zoom. We've had these conversations before. I think we were really looking at the resolution as guiding principles that we needed to sort of fit within. And it's nice to know that we can sort of be the advisory body to those even 13 points to say, some of those are relevant, some of those aren't necessarily so relevant. I think one of the questions that we have, and I know with some clinical staff, Patrick McCormick and I have also talked about this as well, is sort of how the work that we are all doing consistently in the community, much of the time together. So with our mobile health hubs, with our community health improvement plans, our Chinas, our CHIPs, how that fits in with the government section of where the resolution goes. So how do we marry the two together? And I know we have a lot of things in the resolutions about infrastructure specifically within the city. So, it's one of those situations where, I can look on the Zoom call right now, and I know there's 4 individuals that we have an event, almost every month where we're out there, we're administrating, we're doing these things. We collect this data, but we're sort of missing that city of Norwich piece to the puzzle. So maybe you can explain a little bit how we mesh together, how that is a little bit more integrated moving forward.
So I think for me, one of the things that I looked at, and I will tell you, I have one individual. We were horrible when it came to making decisions based off of data while I was on the council. And so when you look at it, we have family, I give the example, we have families that are hungry. We have families that are unable to get from point A to point Z. We have the part of where we had testing service break down. At one point, everybody had to get on a bus and go to Dot Stadium. And so for me, it's looking at the infrastructure of some of the things that we did put in place, and retrospectively looking how do we make it easier for individuals to access both the systems we put in place and the policies. One of the other big ones is that when I go back to as a council, we had that large peak that hit Norwich, getting the word out as to wearing masks, or we're able to help your family get masks, test kits, things of that sort. How do we get that out more than just the newspaper, the social media, more so for those families that don't speak English, those individuals that don't know to come to City Hall, those that are afraid of government, based off of what they may have encountered before coming to America. And so it's really understanding those barriers from an equitable lens, and how we can utilize that to move the system forward. I think the other thing, like I tell individuals, when the mayor started doing biweekly or calls with all of his city departments, and he invited members of the council, he invited our state representative delegation, community agencies, having those calls, and us still continuing those calls even post the pandemic piece, how those things are beneficial. And so I think when you talk about how you mesh the two together, I think that's one of the ways to look at some of the systems that are put in place and how we can enhance it. And, maybe that is a representative from Uncas Health, Hartford Healthcare, UCFS being a part of those biweekly calls. And it may not have to be every biweekly. It could be you're on the call once a month versus two times a month. But that I think is the way that committee giving some of that recommendations or suggestions on how we move forward. That's, I think, the lens of why a lot of the 13 things came up, is us really utilizing the data of peaks and the lows, things that were done in the community to make us sustainable. I think it's important. You look at the little food pantries, all of the other little things that are done. How do we make it so that they are not only accessible, but we maximize individuals in the community knowing about it? They're accessible to them getting there, all of those things. I also bring back, I remember 2 other things. When we first did the mobile food pantry food boxes, before we went up to Foxwoods, where we had, I think it was 4 or 5 sites around the city. One in Greenville, we had one in Taffville, and how we learned from that, where it had its strengths and it had its weaknesses. Issues of traffic, location selections, but it also let us see the need in the community based off of what community site was in. I know for the Greenville site, we were done within a half an hour. We were distributed, but I think it's us understanding that piece of accessibility is important, and it's from the lens of those that are disabled, those that are from marginalized communities that don't have the transportation, language barriers. So there are many things that I think we look at, and we utilize that to get us where we need to go. But I think it's also, the reason I had the health piece as a focal point is because we can see from the highs and lows within the data, what did we do successfully to get us to a safe place? And what things did we do? Because Norwich, for a while, we did an excellent job, you know, even when we had the peaks of getting back to where we needed to go. And so it's utilizing that data, the things we may have done as recommendations moving forward on how we handle any health situation or any other emergency in the city, how we handle it from a communication standpoint, from a data standpoint, all of those. And I think for me, I would say one of the big goals, and it doesn't have to, it's something I'm not expecting to happen in 2 years, but one of the big things that I'm looking for is setting up a system, a data system, a way to utilize data for both the council and our city agencies to utilize when making decisions, both from a budget standpoint, policy standpoint, and also an operational standpoint. You know, because I think one of the things that I say is we have a stake as a city in making sure we're not putting all of the onus on the nonprofits and other agencies in the city to take care of the health need of the entire.
Yeah, I think you really hit the nail on the head there for a lot of the things that we think about. So, you know, especially when it comes to data, I mean, most of us are heading into our new China cycle. We're planning for this year, and you know, even the way that we collect data comes into question, right? There's a lot of individuals who don't get counted through traditional methods of data collection. So we talk about the census, we talk about the IRS, we talk about voters, we talk about education. There's a lot of individuals who don't get counted through that. So even when we have the data, we have those data systems, they are incomplete. So those are things that we're constantly looking on and how we even change that before we get to the sharing of data systems and the lawyers and the HIPAA and all the stuff that's involved in that. You know, I think also about things like vaccine equity. So a lot of us were involved in making sure that we were providing factual, accessible from in your own language from individuals who look like you, who come from your culture, information on the vaccine. So we're not pushing shots, we're pushing access to that information. So there's a lot of that that's going on, grassroots, internally, hospital systems, public health, community benefit organizations. But once again, I think there's that disconnect between what's happening outside and in those communities versus what the city is aware of going on. And I did go to the mayor's call in the beginning of the vaccine and the epidemic. But now on that call, I'm not quite sure what information I should share as a community health director, right? So like those are the kinds of things where I think if we know, I like the idea that the resolution is loose enough that we can really sort of be advisors to that, kind of figure out where to go. But at the same point in time, we also want to be able to find a way for that biodirectional flow of information. Right. And like, how does that come to play? How do we make that easier, considering we have some very large like things to work with?
And I mean, I think for me, the other thing you look at with that is, you know, things you may be seeing as things that are alarming within yourself. Oh, you know, I think it's time of year, flu, RSV.
Right, right.
You know, that playing a role in how we get the information out about vaccination opportunities, but also just the safety. Right. And so just understanding it, you know, looking at it from a seasonal, and, you know, taking it in tranches of seasons or times of year, and what you're seeing within the system and how the city can help from a knowledge standpoint of getting the information out. And so I think for me that, and I will say the same thing I say even being in the state rep seat, is how do we get the information out to the people that need it most in a timely manner, and without it being from a lens that we're pushing one thing over the other. And so I think that's the big piece. Right. I think when you look at the resolution, you know, I talk about meeting and having conversations with stakeholders from different marginalized communities. For me, that's the big part of, you know, you may have a sit down with some of the different communities and them explain they're going to have a different point than I will as to what are their frustrations within the system as it exists. And so that, I think, as you put the plan together, what are their biggest frustrations with how we disseminate information, how we look at data, things of that sort. And so I think for me is the other big task of the committee is how do we make data accessible from a standpoint of it not just being data, but explaining it from a lens that the public can understand. You and I can understand data from a different level than many of the individuals in the community. And so them understanding it from layman's terms, I think is one of the biggest pieces. And this is something that we have to we're working on even the city government side is how do we take the work that we do in council chambers and all of our city agencies and individuals understand the scope of how important that work is. And so I think, that's one of the reasons when I talk about the annual or semi-annual reporting, giving small pieces on that. I'm not saying give all of it, but how do we make it so that they understand it from a layman's terms of this is what we're seeing. These are the things we can do to better it.
So you're saying, and I'll turn it over to the rest of the group too. I don't mean to monopolize, but so you're saying like with those semi-annual updates, we could actually update the city in terms of what has changed in the landscape based on
Yes.
our individual agencies. So it doesn't necessarily have to come from committee work, but the committee is the think tank that can push out the information that's been happening that we're all doing every day in the work that we do. The city may not be aware is actually happening, and therefore there may be some opportunities or pockets of individuals who are also not aware, because that's what we're always up against, right? We do these wonderful things, we have these great programs. How come not everybody knows about that? How come we can't get that information out? So we all struggle on that, no matter what we go. So you're saying that would be a reasonable thing to share.
Yep. And that way you're driving your recommendations at that point are driving from data and the work you're already doing.
Okay.
So I don't mean for this to be
Reinventing the wheel.
Correct.
Yeah.
But I think the 13 points were, when you look at it from a high level, areas of concern for many individuals. It could have been 30, but I think these 13 really cover a lot of what the committee can do and over time. But that's the point, is utilizing, and that's, I think several points talk about data. Utilize the data and the things you're already doing to make recommendations and suggestions about how we make things easier for individuals.
I'm going to open it up. Folks on Zoom or in the room, any questions for Representative Wilson?
Hi, it's Kyle McLean. Just want to say thanks for the great introduction. I read the charter many months ago, but I would say what is the passion that would be the first thing on our agenda? I know you gave it to us as a open charter based on what you wrote, but what do you see as the tip of your tongue in Norwich right now?
Resolution points. What's your number one personally? You can only pick one out of 13 now.
No, we combine them, that's not the end of the other part of it.
Yeah, I can
No,
show you.
no,
I
it's
can
over
show
there.
you on our agenda.
'Cause
It's okay. There's not one thing. So I remember reading it, and I'm gonna, after hearing your comments and your thoughts and kind of our guardrails, I'm going to read it again with a new set of eyes. So thank you.
Your subcommittees.
this is the way we combine them for subcommittee work.
So if I'm looking at it from subcommittees, there are two. And they are internal city processes and legislative advocacy. I say that because when we talk about from a budgetary standpoint, those are going to be your two individual areas that drive some of the other things that you do. Your health equity plan is going to be built based off of many of the other pieces. But I think when you look at those two areas, if you're going to need funding, those are the two areas you're going to really focus on. So, and I think about from a legislative advocacy standpoint, you talk about us having to invest in additional translation software. What does that look like? That's something that Ms. Hayes is going to have to bring back to the council, but also we're going to have to look from the lens of what it costs. And I think from internal city processes, that's what's going to help you figure the role of the city versus the other agencies, such as direct services, things of that sort. So I think those two go together because that's going to help you and moving forward what it looks like over the next fiscal year as you're starting to plan, what that looks like. And so I would say those two are the top two. for you to kind of figure to start with, or really shape some of the others, because you already have some of the data and things of that sort. But those two things, I think, if there are areas where you're looking for them to focus on, in order to get that data to make a firm decision as to whether or not it works or it helps, those are the two areas.
Other questions?
So just so I can do a follow-up on the legislative advocacy, which Patrick McCormick and myself on that committee, there may be one other person. For everybody. But so it was important to have you here today to clarify any questions we had about the ordinance and the resolution that was passed. The next step that we talked about was inviting you, Kevin, and Kathy to the January meeting before the short session starts. And I know Senator, because I talked to Senator Austin this morning, he has $11 million in the budget. He has requests for $750 million. He said, you tell me where to put the priority. But the question I think for us is to have the three of you here so we hear what your legislative agenda is going to be for the short session around public health. Does that make sense? To invite them, because we'll lose them when they get to February. But if we could reach out and ask them to come and tell us what their priorities are, that would at least help us understand the state level. And then hopefully that would help with some of the city prioritization of the budget that we quickly need to have by by March, April at the latest. I know, Bridget, the internal operations have been going on since October.
November this year. I think Josh started late.
Okay, so and I think you guys go till about February, March, right? So at the same time, we're looking at the legislative advocacy piece. Bridget and Chief Daly and whoever else who would give us some of what their internal process is going to look like. So if we're going to have an ask, we need to have it ready by March.
We could focus meetings on that right now because of the time.
Time,
So we
right.
could suspend other committee work and really focus on those two priorities for the next few meetings. If that's something that the group likes, but we'll talk about that afterwards. I see Dr. McLean's hand is raised.
I was just going to say, do you guys have a list of bills that are currently affecting health equity that are on the docket for the short session? Because at some other meetings that I'm an EMS physician as well. And one thing that we do in our larger meetings is we keep a legislative section at every meeting, and we have a bill tracker of anything that's relevant to our group where we could have input, work offline, and make progress on things. And it's hard to keep track of so many ones. So I would love to see if we had like a bill tracker type of bibliography here.
So I will say I don't even think, and I asked this question this weekend, I don't even think we've opened up the portal yet for bills to be proposed for the short session.
Okay.
So we are in that process. I think probably within the next week or so, that portal will be open. So I think if you've seen lately, there's been 1,000 legislative breakfasts and lunches and with just everyone to figure out what, or to put their priorities out before we have bills. There may be some that we as a delegation already kind of have in our mind of pushing. But as far as what's out there for this upcoming session, I have zero clue. One of the other good parts is any bill we co-sponsor or that's a priority for us. We each individually have our own web pages, and on the bottom of the web page, it has its own bill tracker of every bill we co-sponsor or are focused on. And so you will be able to see the process as it goes. Whether it makes it even through the public hearing phase, whether if it stopped there, whether it makes it to the floor, if it's passed in one of the chambers, you will get to see that kind of progression. and we can kind of keep you up to date on that as well. But I do not know what the public health direction is going to be this upcoming session. Some of them I think will just depend on the fiscal capabilities of the legislature. So some of them are going to be depending on an appropriation or bonding or things like that. We haven't gotten that far. And so I think that's one of the conversations we have started to have. I know about a week and a half ago, the Finance, Revenue, and Bonding and Appropriations Committee had a joint meeting to look at where we are from a revenue standpoint and where that goes. Because there are a lot of decisions that are going to be made this upcoming session that are different than what we've had in the last 2 years as ARPA money starts to fade. And so there are some tough conversations that have to be had. But we do not have a set direction on public health or any of those things yet. As the portal opens up and we start to see the bills get flooded in.
Other questions, clarifications?
Thank you. That was great.
All right. We thank you so much for being here today. We really appreciate you taking our questions and helping to clarify some things. I don't think it will be the last time, so you are more than welcome. We may want to invite you many times and really hear a lot about the things that you're doing. It's important for us that this work is really true to Norwich and that we're really sort of reflecting on needs and those priorities. So when you mention, talking to individuals, I think all of us have really sort of taken that turn where we talk to people now. We don't look at what the report tells us. We really want to be able to reach out to these communities and be able to reflect that back to individuals like yourself, like the city, be able to sort of be advocates for that. So I think you clarifying those points for us helps us steer a little bit.
Absolutely. And I think, the other part is if you realize that as you're doing this work, one of the points has to be fine-tuned. I think the council's open to doing whatever has to be done to make the work for you meaningful. And I think it's broad enough that you're not pigeonholed into doing one thing.
Wonderful. Right. Well, thanks again. We really appreciate you coming to our meeting today.
You may get an invite. For January 8th, to give us what at least you might forecast as some public health policies or legislative.
Or health equity work.
Okay.
Perfect. All right, so I'm going to move down to our 6th agenda item here, subcommittee report outs. So I recognize that maybe a lot of individuals didn't have a chance to meet, but I will open it up just to see if any committees did meet, if there was any opportunity. So I'll just call them out. You can either report out or you can state did not meet. So Health Equity Plan, Kathy Special, Dr. Qureshi, Laura Dietrich.
We did not meet. I need to actually meet these people. I've never met them at all. So,
Right. Well, I think that's a good opportunity. Who are the people in your neighborhood? That song kind of comes to mind, right? People that you meet. So feel free to reach out. Everybody's emails is in the most recent agenda that Shield did send out. So we have data aggregation and analysis. I know Patrick just jumped off. Dr. Walia. I don't know if you guys met on your own.
No.
No, did not meet. Direct services, Joe Zuzel, Missy Myers, Dr. Walia, Dr. McLean, or Dr. Mbiwe, direct services. So I will report out for direct services. I'm not sure if I had mentioned this the last meeting because we're going all the way back to September now. We did meet one time and what our decision was to talk to the Community Advisory Council, which Bacchus Hospital has started. This is a new council which seeks to create that bidirectional flow of information that we were talking about from hospital services, but also from the community as well. This would replace our patient family advisory council because we found that those patient family advisory councils were sort of one note in the individuals that we were trying to serve. So this council is made up of individuals from all ethnicities, different languages, all abilities, all ages. And really, there is no criteria that any of those individuals got services within Hartford Healthcare or Bacchus Hospitals. We really are looking for individuals who are ambassadors for that. We did come to that committee one time and ask about needs in the community, and there was some information about heart health, life-saving techniques specifically for our Black and African American population, interfaith church ideas for that. There was also talk about translation services, and as I mentioned, specifically translation services for community benefit organizations who don't have a large infrastructure and can't necessarily afford things like ITI or other translation services while they're working. So St. Vincent's de Paul, for example, Madonna Place, when we don't have CHWs or individuals that can translate, how can we provide that service for individuals who are kind of just scraping by with volunteers? So that's something that we did come up with and talk about. Other than that, we did not meet the following months. Internal city processes.
We have not met yet.
Okay. Legislative advocacy.
So today was the invited state representative Wilson to talk about the initiative. But now it is the next phase is January 8th to invite State Senator Austin, State Representative Ryan, State Representative Wilson again, and I will also invite State Representative.
Great. And as far as goals and objectives are concerned, we did decide in the last meeting that this is embedded in the work of the entire committee. And so we'll be keeping an ongoing record of committee goals and objectives. And we can do that through an Excel sheet pretty simply. Melinda, if you wouldn't mind helping us out with that, that would be great. So as we do these report outs, we could just list them. And then that way we'll know the committee sort of what we've done. And that's information that I can submit in our report back to the semi. Any questions on committee report outs? So I'd like to put a point of discussion forward about our focus, considering that we have the upcoming legislative sessions that are happening, that we kind of shift our focus to focus on legislative advocacy and internal city process. Not sure how everyone feels about that. I will entertain a motion to change the agenda focus to those two topics. So, motion. Okay, Sheila Hayes makes the motion. Can I get a second?
I second it.
Okay, Dr. Wally seconds. Now discussion. So how do individuals feel about this? Is this a good pivot for us? Do we have enough information that everyone can participate on this? Open to thoughts and concerns.
I have a question. And it would actually probably benefit more if Kate were here, but what exactly are you looking for internal city processes?
I think that's a great question. What are you looking
I'm not sure.
Well, so I would say first we need to start with what is the current internal city process?
For what though, I guess, because like what?
Okay, so there's two, from what I can remember with this particular resolution, there were two areas. One is how are we, and it's probably more Kate's department because she handles the public health piece in Patrick's department with our external partners.
Mm-hmm.
That's one area. The other area though is the internal to how each of the departments address this whole health inequity issue within the department, right? So there's and I'm only using this as an example, Chief, okay? But it's one that was quite upsetting to me and as well as others, is like during the pandemic, we had our first responders who had to work. There were certain offices in this building that had to work. I think you had to work. And yet the city did not look to take any of the ARPA dollars to compensate people who were putting their lives at risk because they were forced. You didn't have the pleasure of working at home the time that pandemic was going on. So those are the type of internal things that we look at that had an impact on public health from on the standpoint of just how the city handled this past pandemic when it came to our own employees and our own departments. So there's how do we function within the city with our external partners, and then how do we function within the city? Just appreciating, respecting, and caring for our own public health, our own health, and the inequities that were produced as a result of COVID in the city.
And I think from my standpoint, since I'm not a city employee, so I'm not quite sure, the inner workings. I know for most of our healthcare systems and all of the, other organizations that, what's that? You don't speak. We have a copious amount of trainings, a copious amount of opportunities for education surrounding diversity, equity, inclusion, belonging. From every aspect. So, what does it look like from the city standpoint? Are there opportunities for gaps to be filled with, additional money, right? So could we say, hey, we propose that some money from the legislative session go into training for city employees for those opportunities. That could also be an internal process that would go to health disparities, right? To understand accessibility specifically for individuals.
I mean, I think you even look at from the internal process, starting with communication. So how do you communicate public? What are the tiered levels from employees to the community about a health situation? And kind of back to the point of like what departments are open or are essential or necessary. Because you think about it like people understanding the fact that the city personalized. It's always open. So those things, death certificates, birth certificates, things like that are still able to happen. And then I think of like the building department, there may be individuals that still are able to do that work, and how do they process of some of the things that we've done. So, the software upgrades that the council has. How do we let people know there are other ways to
So in my mind, I think within the committee, we need to be aware of supposing as part of our committee proceedings, we decide on advising the city on a certain aspect, whatever, irrespective of what that aspect may be. Is the city geared internally to support our advice, to act on our advice? That's what I think Daryl means with the internal, whether we are even ready for the advice given by the subcommittees and the committee in general. So to his point, what is the communication level within the city? I don't know. What avenues do you have to communicate to the community? So do we need to bolster that first before we even go into the advising phase of it? So that, I think that's the important piece to learn for us as committee members, I think.
I think that's right on, Dr. Wally, because I'll be honest, I don't know what those processes are.
I don't know. Yeah, right.
Any other discussion? Because we do
What is
have.
under the more? I'm sorry, I see 3. I don't know if they're comments.
I think it's just
Chat.
chat.
So I don't know if somebody was that chief trying to.
Oh, it's just Kyle.
Oh, okay.
So yeah, so we do have a Patrick. So we do have a motion on the table. So we did have discussion. Any other discussion? right, so we'll take it to a vote then, and once again, the motion, Melinda, could you repeat the motion back?
I believe the motion is just to amend the agenda for the two priority items.
The internal, the legislative and the city internal process.
Correct, so
And the internal policies was mentioned first.
internal
Right.
city
But there
process
would be a prioritization order of the two item.
and legislative advocacy.
Yeah, more than the policy internally, I think internal processes that are available currently. I think it's more of an education for the committee to learn that.
So change policy to processes, internal process.
Internal city process. All right, so we'll do a roll call vote. Kathy Special,
Aye.
Patrick Daly,
Yeah, I'm here, yep. Aye.
lost my list of participants. Dr. Walia,
Aye.
Dr. McLean,
Aye.
What did Mark say?
Oh,
Yes,
I said, did you guys hear me?
yeah, I got you.
Mark's yes.
Good.
Sheila is yes.
Joe Zuzel, yes. So motion passes. Moving forward, we will amend the agenda to focus only on the internal city process and the legislative advocacy committees moving forward, and we'll let you steer content for that as in charge of that. Okay, so that brings us towards the end. I see we're at 3:29. So can I get a motion to adjourn, please?
Motion to adjourn.
Second.
Second.
All in favor, Kathy Special,
Aye.
Aye.
Dr. Malia. Yes, Patrick Daly,
Aye.
Dr. McLean. Bridget,
Bridget, yes.
Sheila,
Yes.
Josie, yes, motion passes. We are